Champions for Health is dedicated to providing access to critically needed healthcare for uninsured low-income residents of San Diego County who would otherwise face insurmountable barriers to care. And we recruit, mobilize, and support hundreds of volunteer physicians and other professionals to provide free specialty healthcare and prevention services in the community. And our project is called the Collaboration for Action to Achieve Results toward the Elimination of TB, or also CARE TB, in the San Diego County Filipino and Vietnamese communities.
The communities we serve are the high-risk Filipino and Vietnamese. In San Diego County, the Vietnamese and Filipino communities have our highest incidence rates of TB in our county.
Our goal will be to complete TB risk assessments at 7 outreach activities at events such as COVID and flu shot clinic locations and other preventative health touchpoints in association with our organization, with the goal of reaching 200 individuals, but actually testing 25. With each TB risk assessment, the participant will receive TB prevention education, and for those found at risk, information on testing and treatment is also going to be provided. Our hope is that we're going to have 7 outreach events with an average of 60 participants at each, where we can provide outreach to and provide unique risk assessments to individuals at those. We're also partnering with our advisory committee agency and hosting a COVID Vax clinic that is going to include the TB risk assessment implementation, prevention, and managing distribution, and a testing and treatment demonstration project that will reach up to 25 participants. We're hoping to increase this number and hoping to have a maximum of 25 attendees with a high response rate to develop an outcomes-based evaluation to assess the project's successes and areas of improvement and the different levels of the care cascade model, and evaluating how our materials are related to providing patient retention and care. But we will also review and approve the evaluation plan for the TB risk assessment, outreach, and demonstration projects with our ongoing marketing committee. And then we'll be administering the TB risk assessment with questions to include a short baseline questionnaire to assess if this intervention increased their knowledge about latent TB. And then by the end of the project, we hope to, we will be providing follow-up data on the TB testing and treatment demonstration project and qualitative data, including the reasoning for or against screening, testing, and treatment from participants.
CARE TB is a private-public partnership consisting of 2 San Diego-based agencies, which are Champions for Health, formerly known as the San Diego County Medical Society Foundation, and the San Diego County TB Control and Refugee Health Branch. We are also supported by the work of TB Free California, and that is a partnership among the California Department of Public Health, community clinics, and health departments throughout California to eliminate TB.
We had past experiences with our partners, and when this mini grant announcement came out, this was a perfect time for us to form a collaboration so we could go forward with this project. Prior to our CARE TB, prior to creating CARE TB, the County of San Diego TB Control and Refugee Health Branch was doing TB risk assessments in partnership with Champions for Health at their flu clinics, flu shot clinics in the fall of 2019. And we were able to, through their community connections, We were able to go to high-risk areas, not only in the Filipino and Vietnamese communities, but also in our other high-risk communities as well. So we found that we had a great partnership with them. Their access to the community was exceptional. At the same time, our other partner, TB Free California, I was in conversation with them because they were in need of evaluating some educational materials that focused on Asian Pacific Islanders. And so I offered to do evaluation for the Vietnamese and Filipino communities. And then again, just as luck would happen, and the fact that we've already had these relationships with these agencies, the TB Elimination Alliance came out with the mini grant. So it's just serendipity. It was just a great opportunity to bring our partnership together and then to do our outreach.
For Champions for Health, this grant is important because through the COVID pandemic and through this last few years that have been really challenging, one of the things that we have seen is a gap in services and a gap in language accessible material for Vietnamese and Filipino populations here in our community. As Marty mentioned earlier, we see higher rates of TB among this population, but we also see other preventative diseases in need, especially through COVID. So this has provided a unique opportunity for us to lean into the prevention work that we're doing in the community, expand really our responsibility as an organization to make sure that our services are as language accessible to everybody as possible, and to also work with our county public health and also our private and public partners, which we have many of, to make sure that we are working with them to work with these communities specifically.
I work with TB Free California. I'm relatively new on the team, but I know that the work that Champions for Health has been doing together with the San Diego TB program has been really exciting and innovative. And we really see it as a model for other future potential collaborations that we're hoping to develop in the future. A lot of the activities that Champions for Health is doing are you know, they're not being done elsewhere. And so we learn a lot from them in terms of the models they're creating and the types of outreach venues and strategies. It's very inspiring, I know, for a lot of other health departments in the state to see what they're doing. We hold regular quarterly meetings with TB programs that have elimination plans. And I know for sure that the other programs, when they hear about what San Diego is doing, there's a lot of excitement and optimism and discussion about how these models can be replicated.
From the San Diego County viewpoint, we do a lot of work on the TB case side. So in the as far as when someone is diagnosed with TB, we have the case management down. We take care of that patient. We take care of their families, but we don't have as much resources to do prevention out in the community and being able to connect with the community. That's why we're so grateful for Champions for Health and what they do to be able to make that connection. Also, we have with the California State TB Control Branch, they're doing a TB elimination initiative. And then within San Diego County, we are also doing a response as part of that initiative within what we do within San Diego County and our partners out in the community, both healthcare and community. So we're doing, we're able to expand on what we're doing, showing the examples that we're doing out in the community through Care TB, as far as our expanding our TB risk assessment outreach and doing testing in the community, testing and treatment in the community. We're able to create a template for our initiative, our county TB elimination initiative to follow and be able to expand it into other high-risk areas as well. So we're very fortunate, we're very grateful for our partnership and for this program.
This mini grant has allowed us to really propel a collaborative that that needed some legs and some additional support to be able to get the work done. And it has allowed us to leverage, I think, a whole system of care to bring to bear on this disease state and also on COVID and all the other things that are coming down our pipeline with prevention and making sure that we're meeting our communities where they're at.